Okay, so we've got a really interesting deep dive setup for today.
Yeah.
And, you know, I'm always fascinated by anything that has to do with kids because I have kids myself.
Right.
And we're going to be looking at some pediatric dentistry materials today
Yes, we've got
that you provided to us.
a lecture presentation
Right.
and a student worksheet.
Yeah, and it seems like they both cover, the world of taking care of children's teeth.
Yeah, they both dive into the field of pediatric dentistry
Exactly.
quite nicely.
So our goal, I guess, today is to kind of like go through this material and kind of point out the most important things or interesting things or maybe even surprising things.
I think we can pull out some surprising elements for sure.
Yeah, okay, great. Yeah.
So both sources right off the bat give us the same definition of what pediatric dentistry is.
Okay.
It's basically a branch of dentistry that limits its practice to the dental care of children.
So it's not just dentists who work on smaller teeth.
Exactly. There are specialists in this area.
Oh, wow. Okay.
Yeah.
So they go to extra schooling just to
Absolutely.
learn about children's teeth.
It's a whole specialty unto itself.
That's fascinating.
Okay.
So then right away, in both of the sources, they talk about informed consent.
Yes. Very important.
And so I'm guessing this is like...
That the parent or guardian of the child needs to
give permission.
sign a document saying,
right.
Yes, I want my child to have this procedure.
So this isn't just like a suggestion or a...
It's required.
This is like legally required.
For any procedure.
Wow.
Yeah, no signature, no procedure.
So they take this seriously.
It's a big deal.
Yeah, that makes sense. I mean, I mean, if it were my kids, I would want to make sure.
Absolutely.
Yeah.
So
you know what's going on.
It speaks to the whole legal and ethical side of things.
Right, because a child can't just consent on their own.
Exactly.
They need their parent to be involved in that decision. Okay, interesting.
Yeah, it really is.
Okay, so we've got kind of like the groundwork laid.
Yes.
We understand what pediatric dentistry is.
Right.
We understand the legal and ethical importance of consent. But now, let's face it, most people, when they think about going to the dentist, even as adults, we kind of get nervous.
Oh, absolutely.
So I can only imagine what it must be like.
Especially kids.
For a child.
Yeah.
So how is that handled?
Well, both sources point to the fact that behavior management is a really common challenge when dealing with kids in the dental office.
Sure. They're scared.
Oh, yeah, and they're in an unfamiliar place.
Right.
With strange sounds and people in masks.
And I bet they pick up on their parents' anxiety, too.
Oh, for sure.
Yeah.
Kids are like little sponges.
So it sounds like there's got to be some kind of special...
Oh, yeah. They got all sorts of techniques.
Easy.
Strategies.
Okay.
One that stood out to me was this idea of reassurance.
Reassurance.
That both sources mentioned.
Okay, so what does that even mean?
Well, it's like it often involves this show, tell, do technique.
Do.
Yes.
So like showing them the tool.
Yeah, exactly.
And telling them what it does.
And then using it. It's about making the unfamiliar familiar.
Okay, and the lecture notes, I think, also mentioned that they use euphemisms a lot.
Right, like instead of saying drill.
Mr. Whistle.
Exactly, Mr. Whistle, or something like that.
So they just try to come up with...
Or instead of needle, sleepy juice applicator.
Exactly, right.
Make it sound less scary.
Yeah, okay, so show, tell, do, that's a pretty simple...
Yeah, it's a good starting point.
Framework. Can you give me an example of how that might play out?
Sure. Let's say a child needs a dental cleaning.
Okay.
The dentist might first show them the little polishing brush.
Okay.
Let them touch it, maybe even make it spin a little.
Make it fun.
Yeah. And then they would tell the child, this little brush is going to tickle your teeth and make them nice and shiny.
Oh.
Just like when you polish your shoes.
Oh. Yeah.
And then finally they would do the cleaning. Using gentle movements and positive reinforcement.
So it's really just kind of like breaking it down into manageable steps.
Sized pieces.
Yeah, I like that. Okay.
Yeah.
But I'm guessing that there are times when...
Oh, of course.
Even the best reassurance doesn't work.
Right.
So then what...
Well, both of our sources actually talk about restraint.
Restraint. So like...
Yeah, it sounds a little scary.
Yeah, holding them down.
But they're very clear that this is only done safely with parental consent.
So the parent has to be okay with this?
Absolutely.
Okay, so it's not just like the dentist decides to do this.
No. It's a decision made with the parent.
And it's not about punishing the child?
No, it's about protecting them.
Okay, so how does that work? Like, is there any...
Well, it could be things like using a special blanket or maybe having a dental assistant gently hold the child's hands.
Okay.
Just to make sure they don't accidentally move during a procedure.
So it's like a safety thing.
Exactly. It's about ensuring the child's safety and the quality of the care.
Okay, so it's not taken lightly.
Definitely not.
Okay.
Yeah.
Interesting. And then the lecture notes go on to talk about different levels of sedation.
Yeah, that's when things get a little more serious.
I was going to say, that sounds like that's when maybe reassurance and all that other stuff.
Hasn't worked.
Hasn't quite worked.
Yeah.
Okay, so what are the levels?
Well, they describe 3 main levels.
Okay.
First, you've got conscious sedation.
So they're still awake?
Yes, they're awake but relaxed.
Okay.
It's usually done with an oral sedative, like a pill or a liquid.
Okay.
Just kind of takes the edge off.
So like a mild relaxant.
Exactly.
Yeah.
Then there's inhalation sedation.
This is the laughing gas.
Yeah, that's the one everybody knows.
Yep.
It's nitrous oxide and oxygen mixed together.
Yeah.
And they breathe it in through a mask.
And it kicks in pretty quick, right?
Yeah. It's fast acting and wears off quickly, too.
Okay.
Very few side effects.
So even though it's called laughing gas,
right,
it's not always about laughing.
No, not necessarily.
Yeah, it's more just to
reduce anxiety.
Okay.
Make them feel more comfortable.
Yeah.
Yeah.
And then they talk about general anesthesia.
Yeah, that's the big one.
So this is like...
That's when they're completely asleep.
Yeah.
Unconscious.
I mean, that's when they would bring in like...
Yeah, a whole team.
An anesthesiologist.
An anesthesiologist to make sure everything goes smoothly.
And that would be for like extensive work or...
Yes, for like really big procedures. Or for kids who are just absolutely terrified. Right. It's not something they do lightly.
So you really got like a whole spectrum.
A whole range of options.
Yeah, that's really interesting. Okay, so we've talked about kind of like the overall approach to pediatric dentistry, like how to deal with behavior and all of that. But now let's talk about some of the actual...
The procedures. Yeah.
So what are some of the things that pediatric dentists commonly do?
Well, the first one that both sources mention is pit and fissure sealants.
Pit and fissure sealants. So those are for...
Those are for the chewing surfaces of the back teeth.
Okay.
All baby teeth and permanent teeth.
So all the teeth in the back?
Yeah, because those teeth have all those little grooves and pits.
Oh, right.
And it's really hard to clean them properly.
Even with really good brushing.
Yeah, even if you're a great brusher.
Yeah.
Food and bacteria can get stuck in there and cause cavities.
So these sealants basically just kind of like...
It's like a protective coating.
Yeah.
They paint it on and it hardens.
So it just makes the surface smoother.
Exactly.
So it's easier to clean.
Yeah, it's all about prevention.
Wow.
Yeah.
Okay.
It's a simple procedure, but it can make a big difference.
So they try to do that as early as possible?
Oh, yeah, as soon as those teeth come in.
Okay, interesting. Okay. And then next we've got pulpotomy.
Yeah, pulpotomy.
This one sounds a little bit more...
It is a bit more involved. Yeah. So this is when decay in a baby tooth has reached the pulp chamber.
Okay. And the pulp chamber is...
That's the inner part of the tooth with the nerves and blood vessels.
So it's like the heart of the tooth.
Yeah, you could say that.
Okay.
So what they do is they remove the infected pulp tissue.
Okay.
But they leave the healthy tissue in the root canals.
So they're not taking the whole tooth out?
No, they're trying to save the tooth.
Okay.
They want to preserve it until the permanent tooth is ready to come in.
Got it.
Yeah.
So how do they clean out the infection?
Well, they use these special antibacterial medicaments.
Like a little antiseptic?
Exactly.
Yep.
And then they fill the empty chamber with a special cement.
Okay.
It's called zinc oxide eugenol cement.
So they clean it out, and then they seal it up.
Exactly.
Okay, and then...
And then because it's a baby tooth, they usually put a stainless steel crown on it.
Oh, a crown.
Yeah.
So like a little metal cap?
Yeah, basically.
Okay.
It protects the tooth and makes it strong.
So it can last until the permanent tooth comes in.
Exactly.
Wow, that's amazing.
It is pretty cool.
Yeah.
They can do a lot to save those baby teeth.
Okay. And then the last procedure that our sources mention is space maintainers.
Yeah, these are pretty interesting.
So what are those?
So sometimes a baby tooth is lost too early before the permanent tooth is ready to erupt.
Right.
And that can be a problem because the other teeth might start to drift into that empty space.
Oh, and then the permanent tooth won't have any room.
Exactly.
Whoa.
So a space maintainer is basically a little device that holds that space open.
So it's kind of like a placeholder.
Yeah, you could say that.
Wow.
It prevents the other teeth from moving.
So that's like really important for preventing future orthodontic problems.
Absolutely.
So it's like early intervention.
Yeah, it's much easier to prevent problems than to fix them later.
I like that.
Yeah.
Okay.
Yeah.
So this has been a really interesting deep dive.
It has.
Into pediatric dentistry. We've learned a lot.
I think so.
We talked about the importance of informed consent.
Right.
We talked about all the different ways that they manage behavior.
Yeah, from reassurance to restraint to sedation.
And we've even talked about some of the common procedures that they do.
Like sealants, pulpotomies, and space maintainers.
And I think it really highlights how specialized this field is.
Oh, absolutely.
Yeah.
It's not just about working on smaller teeth.
Yeah, it's a whole different ballgame.
It's about understanding child development, communicating with kids and parents.
It's about making them feel comfortable and safe.
Exactly.
And it's about preventing problems down the road.
It really is a fascinating field.
It is, and it makes you wonder what the future holds.
Right. What new technologies and techniques will they come up with?
Yeah. Will they find even less invasive ways to treat kids?
Maybe even ways to make going to the dentist fun.
That would be amazing.
Yeah.
Well, I guess that's something for us to ponder.
Food for thought.
Yeah. Thanks for joining me on this deep dive into pediatric dentistry.
My pleasure.
It's been really insightful.
I agree.
Okay, so until next time.
See you then.
Bye.